And hello, everybody. My name is Tony Heil with ALS United Mid-Atlantic, and this is our Goals podcast, where we talk about different perspectives on ALS. If you've listened to our past episodes, you have heard from people living with ALS, researchers, nurses, social workers, caregivers, and others who have a lot of different things to say about what it's like to live with ALS, to find treatments for ALS, and to lead our ALS mission. ALS United Mid-Atlantic is part of the wider ALS United Network, and as you may have seen from our recent videos and podcasts and other things, we are doing more to collaborate with our partners and friends so we can come together to find new treatments and cures and support for our ALS families and patients and the wider network. And speaking of network, that's who we're talking with today. I'm going to be talking with Sheri Strahl. She is the new president and CEO of ALS Network, which is based out of California, and they have Hawaii as well, which I'm jealous of, so I wish that they would let us come out there more often, and maybe we could talk about that later. And I'm also going to be talking with David Buseck. He is a board member with ALS Network. He is also living with ALS, and he has a unique perspective on some of the research that they're doing through ALS Network. We're very excited here at ALS United Mid-Atlantic because we're helping to support some of the efforts with research at ALS Network. There's a lot of really great collaboration happening, and I know Sheri and David will have a lot to say about the very favorable things that they're doing and how more people can be involved. So, Sheri and David, thank you for talking today.
To be here.
Thanks for inviting us.
Yes, of course. I'm really, we work a lot with ALS Network, with your team to talk about advocacy, find out what's going on the ground, because you have a really great, well, pun intended, network of people to help out here. Sheri, first with you, when did you first start? What brings you to ALS Network and the ALS cause?
Yeah, so ALS Network found me. I was not looking for them. They found me back a little more than 6 years ago when ALS Network was the ALS Association Golden West chapter. And my background is public health. When I was contacted about the opportunity to join ALS Network as their first chief operating officer, I started diving into the science around ALS and was shocked by how far there was still to go to really find effective treatments and cures. And I immediately felt very passionate about joining the work to change that. In many ways, for me, it feels like a moral call. It's about living an ethical life where the world I want to be in is not one where ALS exists, quite frankly. So that's what brought me to the work. And I moved from chief operating officer as part of a succession plan that was enacted a little more than a year ago. And I'm very honored to sit in the president and CEO seat.
Yeah, and I think that coming from the outsider perspective, you see things that other people might not. And I know from my experience, even though I had a family member with ALS, once you meet just one person impacted by it here, it does become very personal and like a moral objective. I still remember some of the first people I met here, and you never forget just the first people you meet and how you want to keep working on their behalf.
Absolutely true. And there's something about the passion around the mission that's unique in the nonprofit space. That is not true everywhere. And I immediately noticed that every person I interacted with, no matter what their role was, is passionate about the mission, and that fuels me each and every day. When I need a little uplift, I'm surrounded by, we have 60 staff members, and they're all in it for the right reasons, hearts full and ready to go.
And I know I'm going to get to David in a second, and I know we talked about it happening later, but that passion at ALS Network has come a lot through Fred Fisher. I know he left a big legacy there, and I'm sure it leaves a big impact to all of you. I met him a few times in advocacy, and yeah, he would never stop advocating and speaking up on behalf of the patients, and it really set an example for all of us, and I'm sure it still does for you.
Absolutely. Fred Fisher is one of the heroes in my life, someone I grew very close to, and we worked so well together. And it really is an honor to continue his legacy of innovation and thinking outside the proverbial box, taking chances to make big differences. And yeah, we definitely plan to continue living into his maverick spirit.
And speaking of heroes and people who inspire us, David, that brings us to you. You're a board member with ALS Network. You're very involved. Tell us about your background. You're currently living with ALS, right?
I am. To be acquainted with Fred and all that he did over the many, many years he was involved feels a little out of place, but I appreciate the invitation. So I was diagnosed with ALS in 2019, and then of course immediately went into the pandemic. So I wasn't really engaged with very much other than trying to figure out how getting COVID might impact my future health with ALS. Until in 2022, my wife and I decided to go to a fundraiser walk in Hawaii. And when I got there, I had the same experience that Sheri just talked about, which is that I felt so connected with so many people who have the disease or are connected to the disease. And for both my wife and myself, we were kind of nervous about seeing people who are further along and feeling kind of depressed by the possibilities, but really the opposite happened. We were engaged with a variety of people who either are living with the disease or maybe lost family members, as well as people who were part of the ALS network. And that's where I first made the connection with the organization, and then came on board as a board member at the beginning of last year. I had the good fortune to meet Fred a couple of times, but I didn't get to work with him. I was hoping that in our research work moving forward, I would be able to work with him, but unfortunately when he died, that ended that. But his legacy certainly lives through.
And if I know Fred at all, and I don't know him as well as Sheri did, he would be saying the inverse of what you said. He would probably be saying it was an honor to work with you, anything that you had said there. But you made those connections and with other families. And you have a science background yourself, David, right? You have some. What is that? How do you bring that to the table?
Yeah, I studied physics in my undergraduate program, and then I moved to a master's degree in optics. And from there, I moved into work that was always related in some level to physics and optics, although not directly engaged. But the second half of my career, before I retired in 2019, was with a medical equipment company. So I was working with radiation oncology, learning about the physics of the radiation beam and how it interacts with the body, working also with FDA, needing to get different kinds of approvals and learn more about the FDA process. So I feel like all of that has served me well in my process of getting to know more about the ALS science. It's quite overwhelming, and there's a whole lot of it that uses terminology and techniques that I don't know, but I'm learning and I'm enjoying learning and doing my best to also provide a voice to the researchers of someone who's both living with the disease and has some connection to the whole scientific process.
So, Sheri, that reminds me about ALS Network's approach to research. And my experience working with your organization, it is always important to have a patient voice in that, to understand their perspective as you're looking for new treatments or what kind of avenues to pursue. So tell me about what the direction is for ALS research through ALS Network, especially as you're moving in that new direction.
Yeah, thank you for the question. Our research program has a few different prongs to it, if you will. And one of the things we've been known for decades is our work in thought leadership around research. So we host the annual ALS Network Research Summit, bringing hundreds of scientists together there, where they debate, push on each other, present, argue, make fun of each other in loving ways to really move those ideas forward. And within that thought leadership space, we also do a lot of matchmaking and connecting. And, I'll be having a conversation with a company that's developing something that's looking promising and they need an investor. And I know, oh, this company over here, they're looking to invest. And so we do a lot of matchmaking and within that thought leadership space. And as a result of the connections that we build there. So that's one aspect of it. Also, of course, within our care services program, do a lot of work to connect people with ALS to the right research opportunities to them. And those efforts really wax and wane depending on the availability of research opportunities in the region. For example, this is a time where there frankly are not a lot of clinical trial opportunities for our ALS community in the regions that we're focusing on. There are always other research opportunities. There's, of course, the CDC ALS registry that we help people participate in, but that's another aspect of our research program is helping people who want to be a part of research find the right opportunities for them. And of course, all ALS and the AMP ALS work that I know ALS Network is funding, as is ALS United Mid-Atlantic, is a part of our ALS United collaboration across all the members. That's helping provide some opportunities related to natural history studies. So that's another aspect of the program. And then we're also really conscientious about the need for new researchers to be entering the field. So we think and talk and plan about our own efforts to help support early career researchers. Some of that is by providing some funding to other programs who are hosting high school students and interns to expose them and get them excited about ALS research. Barrow Neurological Institute, for example, has a wonderful program like that. We have research awards for early career researchers, so we're always thinking about that. We need new people coming into the field. And then what I suspect we're going to talk quite a bit about today, perhaps, is directly funding research. And ALS Network is directly funding research through two different approaches. One is co-funding research that others are overseeing and grants that others are administering and review processes that others are doing. And, for example, we're partnering with Packard to fund a basic science grant. We have partnered with Target ALS to fund biomarkers because we don't have a basic science program. We don't have a biomarkers program. We don't want to set that up. We want to help really leverage efficiencies by funding those with the right partners who are doing that kind of work. The other way that we're funding research, and the vast majority of this we are doing proudly in partnership with ALS United, including ALS United Mid-Atlantic, is directly funding innovative ideas. So we are really at this point in our young directly funding research career, looking for potentially high risk, but also high reward ideas that are exciting, potentially trying things we haven't been done before, with a focus on disruption more than incremental change. And I will pause there to leave space for us to dive into the details. What I can say is that this open call for letters of intent closed just days ago. We received more than 110 letters of intent, and about 80 of them are either they must move forward in the review process, or maybe we need to look closely at these. Only a fraction of them are, okay, these are not what we're looking for. So we have a wealth of riches in terms of research that should be funded. And the only thing that is limiting us are dollars. The yeses, we have 47 of 110 letters of intent that we see as, yes, this should be funded. We need more information. We're going to ask for a full proposal. This is a yes. That would be $7 million to fund all 47 of those. We need to raise about $6 million more to do that. So that's another thing that we're thinking about and working on is there's no shortage of bright ideas. The only limitation is money.
And I was going to say $6 million, while it sounds like a lot, is also not that much considering the wider expenses of research. So I can't write a $6 million check. And I doubt David can either.
Let's go.
But it sounds like something when you have a number like that it's approachable to the wider ALS.
And I want to add, though, that $6 million would be enough to fund the start of these ideas, not anywhere close to pushing them through to completion. Not all of them are going to make it through to completion. That's part of what we're excited about, is giving people opportunities to try things that may or may not work. But those that do are going to take a lot more funding moving forward.
And David, as someone with a science background, you know how the scientific process works, sometimes too slowly or sometimes really fast. What's your feeling on how ALS Network is handling this really exciting process? Hopefully you find it exciting.
I definitely find it exciting. And one of the things I find exciting is that I think when people think of ALS research, they're thinking about drugs. But we're looking at, have a list of the categories of some of these. Some of them are drug development, which is super exciting, but also assistive technology, better wheelchairs, eye gaze, better communication devices, things like that. Working on biomarkers, which have a range of functionality from helping to diagnose more easily to measuring the effects of treatments and a variety of other things. How people will do clinical practice. We're looking at just a variety of different kinds of research programs that all tie together in complicated ways to improve the lives of those of us who are living with the disease and our families. And I think given the current federal funding situation, this philanthropic work is all the more important because so much federal funding is being pulled or dialed back or leaving people questioning what they're going to be able to do. I hope that won't be a long-term thing, but in the interim, we can fill some of those gaps and provide short-term, relatively small funding to keep people moving and to move things forward.
And to provide a little bit of context too around that really interesting list that David just talked about, when we put out the call for letters of intent, we intentionally made it open. We didn't ask for anything specific. We really want the best ideas, period. So that list that David just shared really exemplifies the great variety of what came through this open door. And now we have the difficult and exciting, as you said, Tony, task of going through all of it to identify that which we are going to be able to move forward for funding.
And getting that many applications, especially for a new project and proposal, really demonstrates the necessity of that federal funding. Because if you're getting that many applications through a new process at ALS Network, and there's already an established process at the NIH, consider how many research projects might not be funded, because there are probably more people that would apply for that because it's been around for so many years. How important is it that we continue to advocate for that research funding on a federal level? We're working with Allison and Audra in your organization and others across the country. What's that impact like? Sheri first, and then David from a patient perspective.
Yeah, it's absolutely a top priority for us, advocating to retain, maintain, sustain federal funding for ALS research is absolutely critical. The scope of those programs, it is not something that an ALS Network Innovation Grant is going to bridge. And the demand on the private sector to try to fund that is the concept that the private sector should just take that on is unrealistic. And what it would take for that to happen would push us back, yes, at least a decade, if not more, if we were ever even able to make that happen. And all of the ideas that we're talking about now, everything that moves forward, at some point goes back to some discovery that was made based on an NIH grant, a DoD grant, like that. That's where the kernels of the ideas, the morsels come there, and then they flow down, hopefully ultimately into commercialization and actual treatments and cures. So all of us doing whatever we can to preserve that, even though I feel the frustration. We already fought for this. We fought for this, we justified it, we got it. I don't want to do that work again. I have too much other stuff to do. But okay, all right, here we are. We're going to fight for it again, and we're going to keep fighting for it because it is critical to getting us to treatments and cures that work.
And David?
Yes, I would absolutely support everything that Sheri said about the critical nature of government support. We have some really, really powerful, exciting corporate partners that are working on a variety of different drugs and assistive technologies and such. But they have a requirement to make money out of it, so they are not able to look at the higher risk, longer term things in the same way that a government or a philanthropic organization can do. We don't need to make a profit from this. We want to come up with a cure. But in order for that to happen, someone needs to make something, and they need to get something back for that in the form of profits. And a government also is able to fund things that don't necessarily give that financial return. And that's the critical function of government funding. And the scale of government funding is also beyond what any individual organization can do, whether they're a profit-making company or a philanthropic organization. So maintaining the advocacy for both federal and state funding is really critical.
David, a lot of people who have ALS who get involved with ALS Network or ALS United in Mid-Atlantic, they're new to the research. They don't know a lot about the advances because why would they until they're connected with ALS? So what have you seen, having been part of this, that gives you some optimism, that makes you excited? Like Sheri mentioned biomarkers, which I think is really interesting because it helps us evaluate things more technology, like you said. From what you've seen already from your discussions at ALS Network, what makes you excited to see those kind of projects come to fruition?
I think what makes me the most excited was the FDA approval of Qalsody, which is a drug that directly targets the underlying genetic mechanisms behind one particular genetic form of ALS. It's a very small fraction of the overall population, but those that are eligible, and in countries that have also approved it and have the insurance that can pay for it. There are a lot of qualifiers on that. But for those that can, I've seen people have complete turnarounds from this drug, and it's the first time we've seen that. So what for me as a researcher, the motto was, if you do it once, then you know you can do it. And if it stops working, whatever project it is, you know you can get there again because you know it did work. And that's, for me, what Qalsody is showing us. We've done it once, and there are going to be other kinds of treatments like that target genetic modifications, genetic mutations. I don't know how long it'll take, but it will happen. And for me, that's just super exciting. And fundamentally, I believe, this is not scientific, but I believe that most or all cases of ALS probably have a genetic mutation underpinning them. So once we know that we can do genetic modification treatments, we have the potential for positively impacting a whole range of people with the disease, different variations of the disease.
And I know from talking with our researchers that if Qalsody can work for people with the SOD1 mutation for ALS, then it's really showing the program book for some other diseases out there. It doesn't necessarily mean it's exactly translational, but I know people with Parkinson's, Alzheimer's, other diseases. And so if you can see that this can work with ALS, I'm not saying it will work for those, but it definitely gives a guideline for here's a way to look. So it doesn't only impact ALS, right?
Absolutely. There was news in the last couple of days about a baby who was treated with a gene editing technique. I didn't follow the details, so I don't know how connected it is, but it was providing to this child, this baby, genetic modification that overwhelmed the toxic proteins or toxic formations that the child had. So already we've seen it in other kinds of diseases.
There's so much interesting work being done around this technology, these ASOs, antisense oligonucleotides, which is what we're talking about. And it'll be really interesting to watch that unfold and see if we're able to get more wins like the one we're describing. There's so much innovation happening, the use of machine learning now, and what we can do at how quickly we can analyze large health record sets. And we have a funded project that we're doing to really look and see if there are risk or protective factors related to other medications that people with ALS may be taking. And again, being able to run these huge health record sets through these giant computers is helping us move the needle in a different way and ask questions in a different way. And this ties David's point about, what are the genes at play? And we've learned so much over the last 10 plus years. And now people are wondering, is it a combination of genes? Is it something more complicated that we need to be looking at? And this use of giant computers and machine learning makes it more practical for us to ask some of those questions and to also do other work around potentially existing drugs. So lots of stuff happening. The biomarker work is really important. We know, we've watched so many things fail or fail to meet their endpoints. We can't help but wonder if biomarkers are going to help us better understand what works for which subpopulations of the ALS community. That's going to be incredibly important, and that's going to start impacting trial design. So there's a lot happening in a lot of different places that is hugely important. And we haven't even brought up misfolded proteins. So there's that too. And we have a project that we funded where we're looking to see if there's potentially a subgroup of sporadic ALS related to a specific misfolding protein that then, if this bears out, we're waiting for the results. If we confirm that there is this subtype, this subgroup, now we have a new therapeutic target that overlaps with other neurodegenerative diseases. We're playing on all the lanes at the bowling alley to try to figure this out.
I want to add a little bit too to what Sheri just said, both about machine learning and about the missed endpoints on certain clinical trials. Because what we're learning is there are multiple variations of ALS, and certain drugs formulations may work for some of those variations but not for others. Maybe for younger ALS patients versus older, or people with different ethnic backgrounds or different genetic characteristics. And we didn't have the knowledge or the power to be able to separate those from each other in a way that we have more capability now. So using these machine learning techniques, it's possible that we could go back to some of the data sets from other trials that, quote, failed. Maybe they succeeded on people who had a particular, say they succeeded for 10% and failed for 90%. If those 10% all have the same genetic mutation or whatever it is that might be the case, that may be something that's worth looking at again, as well as repurposing existing drugs that are used for other diseases. And this machine learning has the potential for helping to let us look at things in different ways than we ever have before. And that's really,
I think that really speaks to the importance of having diversity in research and diverse subsets of people participating in research, whether it's their ethnicity, like you said, or age, or how long they've had the disease, all sorts of things that can go into that diversity, but that helps you have much better sample sizes, a broader perspective, and a bigger approach. You're able to see why things do or don't work when you have more diversity in research.
and I've seen some very interesting data showing discrepancies in ALS, the number of people who get ALS in Africa versus Asia versus Europe. And we have to be able to look at that diversity and consider what those factors might be. So it really is an important part of the overall process, is to include people from as many different areas of the world, cultural backgrounds, colors of skin, genders, because all of those could have factors that we don't know yet that impact a person's likelihood of getting the disease.
I imagine in that instance, you're also because we talk about their diet, the kind of thing they eat, because if they're from a particular country, and I don't know, maybe they eat one thing, and as a result, they don't get ALS as frequently, or maybe they live longer, and age is obviously a factor in a lot of diseases. So the more information you have, the better. I'm sorry, Sheri, I didn't mean to interrupt.
No, I was just going to say it's another reason why it's so wise for our ALS multidisciplinary centers that are running clinical trials to really partner with their patient advocacy organizations for that recruitment piece, because locally we can reach communities that the clinics may not be connected to and really help increase diversity in trial participation.
Yeah, we talk about a lot of things like the Healy platform trials and some other ways that researchers are collaborating. When you have an advocacy group like ALS United Mid-Atlantic and ALS Network, you can say, we have these 50 people that are very involved in research, but we're really missing this group, and these people want to get involved, but they live 100 miles away. Can they participate? And now I know that more people can participate in research from home than it ever before, because there's more tools that I'm sure you're helping to do through ALS Network, where people can participate in research trials remotely.
Yeah, we definitely are connecting people. That is particularly true in our region for some of the natural history studies. Helping people not have to travel for research is also going to be an important part of future trial designs, really. And it has to be accessible. And that ties not only to recruiting people to participate in clinical trials, but retention. And I know that sometimes there's a problem with people dropping out. And, the trial designs have to really minimize the burden on the participants and caregivers as well. Doing as much from home and being creative with wearables is a part of solving that.
And that's definitely an important part of all these trial designs, because fatigue is a huge factor. At the end of this podcast, I'm going to take a nap because I get exhausted, and I know a lot of other people do too. So including keep people with ALS and their families in the trials really requires thoughtful design to minimize the impact that participation has on them, and that helps recruit more people, and it helps with the retention that Sheri was talking about.
Well, you also reminded me, David, from being in Hawaii. Over 25 years ago, I spent a small semester in Hawaii for a class for intercultural communications, because Hawaii is one of the most diverse places in the world culturally. There's so many different groups that are there, and groups that people don't even realize have a significant population in Hawaii. And I'm sure, Sheri, from whether it's Hawaii or California, you see not just about the genetics and how they can be part of a clinical trial, but the communication you use so that you're able to recruit people because you understand the sensitivities in a cultural group. You understand, how you can have the right person asking so that you're sensitive to them and making sure that they feel welcome. And you guys do a lot with making sure you can have those sensitive and appropriate conversations so more people feel welcome in the research community.
And that's all about building trust. And we've been in Hawaii for more than a decade now. And our Ohana in Hawaii was appropriately, okay, we'll see about you all from the mainland. And we loved that. We had to build and earn that trust. And I think that is fair. That is a fair expectation of us. And we're always living into that respect and living into the expectations our communities have of us. And Hawaii is challenging when it comes to research. There are not a lot of opportunities. The healthcare system has unique challenges. It's not easy being an island in a series of islands. So it's more of an uphill battle in terms of access to research in Hawaii. And a lot of our families facing ALS in Hawaii end up traveling to the mainland to participate in research. So we're trying to change that. We're working, we're at it, but it's not easy to be quite transparent about it.
Glad you're doing it, and I'm glad that you guys are leading so much and bringing people in that open-minded perspective on it so people can ask questions, join there. One thing it does remind me, you talked about the public-private work that you're doing, bringing people together at your conferences, is you said we've had some successes, like David said with Calcity. So when you have these successes, does that help get those partnerships more when you're talking to people? They're more interested in doing that next investment or partnering with this other group because they see that, wow, at ALS Network and the wider community, you're getting things done. So it's a more exciting thing to work on that as opposed to some other avenue of research.
Yeah, listen, it's tricky for all of us. It's tricky for everyone in this ALS research space because there have been more failures than successes. And the important thing to take away from that is that we are learning every time. It is not without value. It is helping us focus and learn what to do next. And the successes certainly help show that there is forward momentum. We are getting somewhere and getting into deeper, more detailed conversations like this one with people to help show and describe the progress that's being made, even though we don't yet have that. Here's the cure. This is it. Take this and you're done. We don't have that yet. So we have to explain the steps along the way for people to see the value of helping to power the science that we need to figure this out.
Great. Now, David and then Sheri, this is a two-parter. David, why should more people with ALS and caregivers and families participate in these research programs? And then Sheri, how can they do it?
So it's not for everyone. I'll start with that. Some people aren't going to have the bandwidth or don't have they may have a very aggressive case of the disease and they just don't have the time left in this world to do it. But for those who do, for me, it brings me sense of meaning that the work that I'm doing in the research space, whatever it is going to help the next generation of people who are diagnosed with this disease. It might help me, but I honestly don't think that's very likely at all. But I think that it's working for the future and bringing meaning into having a disease that we didn't want to have, but let's make the best of it. So for me, that's really a driving factor. I imagine it would be for others who might want to get involved. But at the very least, I've learned so much about my disease and so much about how to think about it, how to approach it through my interactions with people who are working in this space, that really is also a big motivator.
And I'll jump in with part two, which is how can people get involved if they want to either participate in research or be a part of powering research. And the first answer to that is to connect with your local ALS United member. So whether it's ALS United Mid-Atlantic, ALS Network, we can answer all the questions, get people connected in the right way, and really make that happen. Related to that, I said it earlier, the only limitation are the dollars. So people who know people who might be interested in investing in ALS research, connect us to them. People who know people who can help get the word out for us, who want to participate in an event. Participating in a walk and roll event and fundraising amongst your groups of peers, every $5, $50, $500, $5 million, it all helps us get closer to figuring this out. So each person will figure out the meaningful way for them to be involved, but connecting with your local patient advocacy organization, particularly your local ALS United member, is the perfect first step. There's so many ways to be involved.
And you can learn more about what ALS Network is doing by following their very easy to find website, which is just alsnetwork.org. You'll learn all about what they're doing, learn about Sheri's work and their whole team. And if you're interested in learning more from us at ALS United Mid-Atlantic, our website is alsmidatlantic.org. Thank you so much, Sheri and David. I hope you have a great nap. Maybe I'll take one too.
Thanks, Tony.
Great. Thank you, Tony.
Appreciate what you have to offer. Again, please subscribe to our YouTube channel and Spotify and iTunes. Share this with your friends on social media and email. Leave your comment below if you have any questions. We'll pass it along to David and Sheri. Maybe there's questions they want to answer in the comments. And we'd love to hear from you, our listeners, and our audience about what you'd like to hear about ALS to educate you and work with our great ALS United partners and collaborators around the country. Thank you again, David and Sheri. I can't wait to work with you again soon.
Thank you.